Our country battles the COVID-19 pandemic. Hundreds of healthcare practitioners in Gauteng are still waiting to be placed. After months of waiting, a group of eager practitioners are taking the stand. They'll be marching to the Department of Health to demand that they be placed so that they can start working. They include doctors, nurses and dental hygienists. Our reporter Heidi Giokos is covering that story for us. Let's cross to her live now. Heidi, for a lot of these healthcare workers, they've done what they need to do. They're almost at the finish line. They just need to be placed so they can work. And at the same time, we're also hearing stories of lots of gaps in our healthcare workforce. So why is it so difficult for them to get their placements?
Yes, I think it's quite a concerning picture for these doctors, nurses and other healthcare practitioners that have not been placed as yet to do their community service and internships. That's normally what happens after you complete your studies and you have to do either 12 months or 24 months of community service. And these healthcare practitioners are saying they do not understand why they have not been placed at a government facility to complete this community service and internship so that they can then move on and either start their own practices or work for other governments or even private hospitals. So they will be marching to the Department of Health. It's just behind me over here. It's not a very long march. It's literally just across the road. And they will be handing over a memorandum to the Department of Health. We understand that they would like to hand this over directly to the Health Minister, Dr. Joe Pahla, but we're not entirely sure when this is expected to start. Initially, we were told they would begin marching at about 10 this morning. It's now been moved to 10:30 for 11, but there's still nobody here yet. We were told it would be over 100 of healthcare practitioners marching here today, but we wait to see exactly what the situation is and hopefully get an answer from the Department of Health as to why exactly these healthcare practitioners have not been placed as yet, because it really causes concern, especially because we're in the middle of a pandemic and we're hearing how there's a shortage of doctors and nurses and other healthcare practitioners, especially during this pandemic.
Well, Heidi, have you had a chance to speak to any of the organizers of this march or any of the doctors, nurses who were meant to march today about how they're doing mentally? Because it must be tough when you finished your studies and you're sitting at home, sort of twiddling your thumbs, waiting for something to happen, and also how they're surviving financially.
Yes, sitting at home waiting to be placed, especially when you can see there's a need for healthcare practitioners, that surely can't be easy when the country is in desperate need of doctors, nurses, and basically any other healthcare practitioner because of what's happening with COVID-19 and what we saw with the third wave. And it just seems as though government is not in a position to give them an answer. Yesterday, when we briefly spoke to some of the organizers, they did tell us that they are extremely frustrated and concerned, and they did not want to march to the Department of Health because they had tried to reach out a number of times to the department to get some clarity, but they're saying this is their last resort and they are extremely desperate to get some answers. It cannot be easy. We do know that our unemployment rate is extremely high, but it also doesn't paint a great picture when it's a department and a sector, if I can call it that, that is in desperate need of healthcare practitioners, and you're just not placing them to complete their community service and their internship. And this is an issue that has been going on for some time now. It's not new, where you're having healthcare practitioners saying we're just not being placed, or we're being placed in hospitals that are just not favorable and in very bad conditions. So it makes it very difficult for them to complete their community service. So we'll obviously get a deeper sense to the actual issues, but what I can tell you for now is that it has not been easy, and it's been a tough year or so with these healthcare practitioners sitting and waiting for government to place them at various government facilities across the country.
Yeah, it must be really difficult for all of those healthcare workers. Thank you, Heidi Giokos. Heidi is in Pretoria, where healthcare workers are set to march to the Department of Health. They're waiting to be placed to do their community service so they can finally get into the workforce for real.